Dr. Gardner here at the Vein Institute. This is our catheter that we actually access the vein with. We take a needle, we puncture the skin. After we make a little numb spot, we puncture the skin, we go into the vein, just like if I were going to start an IV in your wrist. Once we access the vein, and this is our vein, then we slide this catheter in. Now this catheter has a lumen to it, so this is hollow. This goes inside just to fill the space while it's going into the vein. So this is the process. All right, now, so you can see that the catheter is into the vein. Now we're going to pull this side out because that's the filler part. Then we're going to take the radiofrequency catheter. We're actually going to insert it through our introducer sheath into, and you can see it sliding into the vein. So that's how we get it into the vein through the skin. So we do all this through a little 1 or 2 millimeter puncture site. So then, once that's in position, we actually slide our catheter back out of the skin. And what that does is it leaves the catheter inside the vein. So when we turn the catheter on, you're going to see this side of the vein where the heat source is going to actually shrivel up from the heat. It's a pretty neat process. This allows us to do this in a minimally invasive fashion. Minimally invasive means quick recovery, minimal downtime, and back to work and back to regular activities within a day or two. Wanted to show you the follow-up. This is the vein after we ablated it using the radiofrequency technique. Basically, we cooked or cauterized the vein from the inside. As you may recall, that vein was actually, that's 10, 20, about 25 centimeters. Now it's literally about 10 centimeters. So it is shriveled up. It's half the size, or more than half, or less than half the size it was to start with, because we've cooked it, cauterized it, with the radiofrequency catheter. The body will then get rid of this vein via the inflammatory response over time. But this is how we do a minimally invasive procedure. We cauterize that vein using micropuncture techniques so we don't have to make big incisions. And you heal up faster, you get back to regular activities faster, but this is how we do it.